If you have high cholesterol, you might have heard of Repatha, which is a seemingly miraculous drug that many people are wanting to take because it has real benefits. But let's go over the honest truth here, which can be surprising. So we know that Repatha can drop your LDL, your bad cholesterol, to even around 30, which is a very low number. But you might be surprised to know that a lower cholesterol does not necessarily mean a longer life. So hang with me, and we're going to get through some of the most important things you need to know about this medication. Who's going to benefit the most? Maybe it's you, maybe it's not you. I want you to consider whether you're going to be in the population of people who's going to gain from this medicine. We'll go over which type of heart emergencies this medicine will actually help you with, and who should actually not take this medicine. When do the risks outweigh the benefits? Of course, you want to talk with your doctor. I'm not your doctor, but if you hang with me, we're going to get to these questions. I'm Dr. Huck. I'm here to empower you with knowledge to make better choices about your health in a evidence-based manner. And I'm a Harvard-trained doctor, and my goal is to cut through the noise to get you right to the signal of what is most important. You wouldn't be watching this if you weren't worried about heart disease, as I am myself. I have a lot of high risk factors for heart disease. This is the number one killer, number one cause of death in America and across the world. We know high cholesterol is a major part of this problem, but one size does not fit all. And many times we're overtreating some people and undertreating others. I'm going to try to show you how to look at this in a more granular manner. So first, we want to understand what exactly Repatha, which is called a PCSK9 inhibitor, what is it doing? What do some of these clinical trials show us about effectiveness and safety? And then let's address some of the common worries about this medicine. For example, memory loss or brain fog. So what Repatha is doing is it's an injection. You take it every 2 weeks, and it works by preventing this protein called PCSK9 from destroying your liver's LDL receptors. And what that does is that changes the amount of LDL that winds up in your blood. So think of it as allowing your liver to vacuum up LDL from your blood more effectively. That's a nice way to think about it. The molecular mechanisms are quite complex, but it's another way to decrease LDL. So typically people will start off with high cholesterol, go on a statin like Crestor or atorvastatin. Their cholesterol will go down by 50%, 40%. But the Repatha, when you combine it with a statin, will drop things an additional 60%. And the Repatha is much stronger than the statin. And if you're somebody who's in a high risk group, that's exactly what you might need. So let's take a look at one of these landmark trials. So this study was looking at people who were very high risk. These are people who had a prior heart attack, a prior stroke, or known artery disease, for example, peripheral artery disease in your legs. So again, this is not really healthy people who just have some high numbers. These are people with known cardiovascular disease. And what we see is that when you give Repatha, you get a sustained drop in LDL down to 30. And this is within only a couple of weeks, 4 weeks, and it's maintained for years. So you can go from a 90 or a 100 to a 30 pretty reliably with Repatha, which is a much bigger jump than with statins. However, keep in mind, what were the actual outcomes? The relative risk was about 15%, but the absolute risk, meaning the overall number of bad things that decreased, was only 1.5%. But that's still thousands and thousands of lives that are affected. So you always want to think of relative risk and absolute risk as separate. What were these outcomes? Heart attacks went down by 27%, strokes went down by 21%, and stents, the need for a procedure to open up a clogged artery, went down by 22%. And those are important outcomes. Those are non-trivial. Those are really important outcomes. But the one thing that Repatha did not do is it did not actually extend people's lives. And this is where the rubber meets the road. Whenever you're studying an intervention, you really want to know, does it extend life? Because that's what people want. So there was no extension of lifespan. This surprises some people. There was no change in cardiovascular death outcomes. But you could say it's still beneficial because people had fewer heart attacks, strokes, and surgeries while they were alive, which is a great thing too. So just keep that in mind. However, you might be wondering, are there any side effects of Repatha? So with statins, there is a signal for increased diabetes risk. Here, Repatha had no increased risk of diabetes. The other thing that people worry about with statins is muscle injury, or something even more extreme called rhabdomyolysis. But Repatha doesn't affect that pathway, so there's no real increase of muscle injury. Similarly, there's no problem with liver enzymes going up, no liver damage, which can sometimes happen on statins. But there is a injection site reaction risk of about 2.1%, and this is often pretty mild because, of course, you're injecting something into your body. So the side effects are actually pretty tolerable. One of the main things people worried about is that if you decrease LDL to such an extent, is it going to mess up your brain and your memory? Is it going to give you mental fog, cause cognitive side effects? And this was directly tested in another study called the Ebbinghaus study, where they did a bunch of neuropsychological testing on patients, including on things like memory, focus, and speed. And what they found is that there was no cognitive harm when people were taking Repatha, even when LDL dropped to 25, which is very low. So, no difference in things like memory and logic, executive function, reaction time. So, if your LDL does get that low, there is some evidence that it's not really starving the brain and it's not affecting cognition. Because you have to remember, the brain makes its own cholesterol locally, and cholesterol is important for the brain. So, with your doctor, you want to consider whether this is something you actually need. How are you going to do that? Here's a couple guidelines to think about from some of these published sources. First of all, remember, Repatha is not the first medicine you should take for cholesterol. You want to think about first starting a statin. This is the standard guideline. And if the statin is not working or if it's intolerable, your doctor will probably add something called IA or ezetimibe. And third, then and only then will most doctors consider adding this PCSK9 inhibitor, Repatha, if the LDL is still above 70. Because for someone who's high risk, your doctor probably wants to get you below 70. There are a number of gray zones. Most people are not in obviously high risk or totally low risk categories. Most people are in the middle. So, what if you can't tolerate a statin, but you don't have evidence of heart disease yet? You haven't had a coronary calcium score that's really high. You haven't had a heart attack. You haven't had a stent put in. Or what if you have a test for coronary calcium that's high, but you haven't had any heart attacks or strokes? Or what if you have just extremely high risk? You have a high LPA, you have a really strong family history, and your doctor's just not really sure what to do. In those cases, Repatha is in this gray area and things are still controversial, but it depends on your personal preference and what your doctor's willing to do and what your insurance is willing to cover, really. It is an expensive medicine. Originally, it was like $14,000 a year. Now it's maybe $5,000 to $6,000 a year. Your insurance is going to require prior authorization, and it's going to take a couple weeks and months. Sometimes you might get denied. You have to reapply. You have to appeal. But for many people, if you really are high risk and you get this, it's worth the fight. It's worth the wait because this can really change your cardiovascular risk. But remember, it's not going to solve all your problems. You still have to focus on nutrition, physical activity, avoiding smoking, avoiding too much alcohol. Repatha is not going to be a cure. It's just going to manage your risk. It's going to decrease your risk, but you have to still do all the other things, of course. And it's not yet shown to extend life. But for example, if you have a high LPA, like for example, I have high LPA. This is something that I've been considering taking because I also have a very strong family history. What can we say from these studies? They're only following people for about 2.5 years. So we don't really know, like, for 20 years, what the long term effects of this medicine are. And remember, these studies have been done on people who've already had disease, who already have heart disease. We can't really generalize them to the regular non heart disease population. And as I mentioned, we don't really see a signal for extending life yet. So this is what the data can't tell us. So the longest studies we have are about 8 years. And everything shows that Repatha is safe so far, but it's still newer than your statins. And one of the things we don't really know about is whether people are going to have issues with other hormones, because cholesterol is really important for synthesizing other hormones like testosterone, estrogen. So we don't really have a lot of data on that. So every medicine has risks and benefits, so something to keep in mind. Common question that I hear is Repatha going to increase my risk of diabetes? This is a common fear among people who take statins. With Repatha, we don't see a clear signal and we don't see new onset diabetes in these clinical trials. So that's good. Very reassuring. Another question you might be having after seeing some of this data is, I've not had a heart attack. Is this Repatha recommended for me? Generally, the answer is going to be no from your doctor, unless you are in a very high risk category. You already have heart disease established. Maybe your coronary calcium score is very high. You have a high LPA. You've had a heart attack. You have a strong family history. That's what your doctor is probably going to look for in deciding whether this is for you. But for most people, it's more of a third line medicine. Many people can't tolerate statins, and then they're going to go to Zetia or Repatha. And so that's one of the reasons insurances will cover Repatha. So if you have true statin intolerance, like you have true myopathy, muscle pain, new onset diabetes, brain fog, whatever, It's going to require documentation, but generally that's one of the reasons people will go for Repatha. And the reason doctors don't start with Repatha, even though it's more effective than statins, is statins have been shown to reduce mortality. They actually extend life, whereas Repatha has not been shown to do that. Repatha is also very expensive, and current guidelines require the stepwise approach. So that's why people are not going to just jump to Repatha. But high cholesterol is very common. Tens or hundreds of millions of people are affected by high LDL. So this is going to be really important to think about for a lot of people. If you have a normal LDL, your doctor might still consider Repatha for you if you have very high risks. So remember, in these studies, there was still benefit for reducing heart attacks and strokes when people's baseline LDL was only in the 70s. But of course, you have less improvement to go towards, but there's still some improvement in these outcomes. So if you are in a high risk group and your LDL is in the 70s, you may still want to consider Repatha with your doctor. The most important thing to remember is these are all just statistics. These are population level statistics that describe thousands or millions of people and patterns, but you are one person. You are an individual. There's only one person in the history of the universe that's going to live your life. So you have to make these decisions based on your unique needs and goals and your own health history. So always interpret statistics in light of the one precious life that you're going to live. So in summary, Repatha is an amazing drug for lowering LDL. It does decrease your risk of heart attacks, strokes. It requires a long-term commitment. You're going to have to be on it for many years, if not for life. And it's not easy to qualify for. And you may not even need it. So you really want to think carefully with your doctor about this. So think about what you've already tried. What are your current risks? What is your tolerance for taking an injection? What is the amount of cost you can afford? And are you somebody who wants to prevent events before they happen? Or are you willing to take on some risk to decrease the complexity and cost in your life? These are very much not medical questions. They're more ethical or value-based questions. But I hope I've been able to give you a chance to think some of these things through. Here's some of the sources. And if you found this helpful, check out this other video. Share this with someone you love who has high cholesterol. I hope they can benefit. Feel free to join my free newsletter. Take care.